This week, our nation observed National Vasectomy Day. Did you know that that actually existed? Probably not, because it's not often talked about. After a man has had a few kids, or at least as many as he and his wife want, there's often an uncomfortable discussion about getting a vasectomy. Terms like cut and snip usually scare men and make them run for the door. Not to mention that the procedure, while quick and painless, is meant to be permanent. Well, there is a new procedure that would use gel rather than scissors, and it might make the idea of a vasectomy easier for men to accept.
Then what we're doing with a vasectomy is we're just cutting the vas. And what this new vasal gel is trying to do is a little bit different of a concept. You've got the vas, again, open tube, but instead you're actually using a gel substance to just block it off. That instead of just being able to have this forever, what we would then do is later on, if you ever wanted to reverse it, then you could just inject something and get the road open again.
Now, with the current method, reversing a vasectomy is not easy. It takes hours of surgery and it could lead to complications. But the vasal gel reversal would be as simple as the injection as you saw.
If we can make a gel that's easy out, you can even imagine one day there being an on and off switch for this kind of thing. And to be honest, that's neither good nor bad. It's just a matter of how you use that kind of thing. I think as a society it's interesting to think about sterility, what that means, and who gets it.
Yeah, it raises a lot of interesting questions.
Sure.
In fact, the doctor even said technology could advance to the point where, he mentioned sterility, prisoners, pedophiles, as we've heard talked about, but also just for people that want an on-off switch where they could literally turn it on a Friday and turn it off on a Monday. It's very interesting. By the way, this technology, this gel, is being used here in the Valley already for kidney stones. It freezes the stone in place, and then they can zap it without it moving around. But what do you think about
That's kind of fascinating, and I know most guys would say, hey, that sounds a lot easier to take than what did you plan on doing to me? It's
the cold peas in the freezer.
And I want to say, try having a baby, okay? Good luck with that. But it's a little bit easier to take for guys.
It's not out there in practice as of yet. It might take another year, but definitely something to think about.
It is. It's kind of cool. So you're a year out. Think about it now.